Now, in a developmental eye exam, there are 6 different questions that the doctor asks. And the first 2 are, can you see and are you healthy? And every eye doctor is going to ask those questions. And what that comes down to is, do you have the right parts in the right place, and is everything healthy? And can you read the eye chart? But what it doesn't ask is, how much effort does it take to read? How accurately do your eyes move? How well do they work in concert with each other? What ability do you have to move your eyes from one location to another on a page? Those are all things that developmental optometrists will quantify and are usually overlooked in a routine eye examination. There are 3 different areas of visual motor performance which we're assessing. We're going to look carefully at the focusing ability of the eyes. We're going to look carefully at the eye alignment skills, and we're going to look carefully at tracking. Those are the visual motor components. We're also going to look at some visual perceptual skills, including things such as visual memory, sequencing, closure, laterality, and a variety of other perceptual areas. When we look at the focusing ability, we don't just look at something up close and say, can you tell what it says for over the course of a few seconds. We're going to look at the accuracy with which you focus. As an example, most of us, when we look at something up close, we actually focus behind what we're looking at. And that's normal. But it's not normal to focus in front of it, and it's not normal to focus way behind. But we can identify exactly where you're focusing when you're looking at something that's up close. We also expect you to be able to change focus easily. Be able to look far away, look up close, far away, up close, very rapidly. We also look at the ability to maintain focus for prolonged periods of time. And we expect that you should be able to exert a very large amount of focusing ability, and then typically you're only using a small percentage of it most of the time. And if you're using a large percentage of your overall ability, naturally it's going to take more effort. So focusing is something we're going to look at very carefully. We also look at eye coordination and eye alignment skills. And one of the questions we'll ask if you're looking at something far away and your eyes are lined up with each other looking far away, how well do they line up? Do they turn in? Do they turn out? Do they go up or down? And most eyes are parallel when you look at things that are far away. When we then we ask the same question up close. And when we look at things that are up close, the normal posture of the visual system is to have the eyes wander out very slightly. So what happens when we look up close, we tend to focus a little bit behind what we look at. We also tend to line up a little bit behind what we look at. And that's sort of the normal healthy posture of the visual system. What a developmental optometrist, though, is also going to do is to look at, well, where do we actually line up? Do we line up in front of what we're looking at, that is things closer to you, or do you line up further away than you're supposed to? Very often, a visual motor problem is caused by a mismatch between where our eyes line up and where they focus. So when we look at things up close, we end up with an unstable visual world. Or another way, if we looked very carefully, we would see that you sometimes see things clearly, but slightly doubled, or singly and slightly blurred. Most of the time what a child will do is say that words move on the page, it's hard to stay on task for a long period of time. Those are typically the kind of complaints that they'll make. So focusing and eye alignment are common problems in developmental eye care. Tracking is another issue. There are 2 types of tracking eye movements. One of them is called a pursuit. And a pursuit is a smooth, steady movement, like watching a ball move through the air or a bird move through the sky. So you're following it slowly and carefully as it moves. Reading eye movements are called saccades. And a saccade is a jump. So you jump, word group, word group, word group, next line. Jump, jump, jump. Both pursuits and saccades can be quantified. And we find out that, lo and behold, like everything else in the world, some people are very good at age 8 in performing accurate reading eye movements, and other people are not doing so well. But we don't really know unless we look, unless we measure. So tracking and reading eye movements are another aspect of developmental eye care and visual motor skills the developmental optometrist looks at. The sixth question, so the first two are can you see and are you healthy, and then focusing, tracking, and eye coordination. The sixth question that a developmental optometrist looks at is visual perceptual skills. And there are a variety of different tests that we can use to look at the basic visual perceptual skills. One visual perceptual issue is laterality, that is being able to discriminate left and right. As an example, these should be the same, this is different. Can you tell? Why does your child write down B for the letter D, and vice versa? Why are P's and Q's confused? Are they inappropriate? You know, in first grade, to have reversals like that is really fairly normal. But in fourth grade, it is not normal. And the question then is this something that's happening inside their head, or is it something that's happening in their eyes, or perhaps with the motor skills? Those visual motor and visual perceptual skills are an essential part of visual development, which then dovetails into the development of academic skills, particularly reading and math.